Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Welcome to the 83rd episode of the Eat Away Kidney Stones podcast. As always, I'm your host, registered dietitian and kidney stone expert, Melanie. Today we have a very special guest on the podcast. Her name is Dr. Jessica Knurick. She is a fellow dietitian, but she also has a PhD specializing in nutrition and wellness as sort of more of a public health emphasis. I initially discovered Jessica on Instagram because she had a ton of wonderful stuff around myth-busting pre- and postnatal care from a nutrition lens. You may or may not know that I had twins about 3 years ago, and so was really drawn to her at that point because of that content. However, lately, for obvious reasons, she's been focusing a lot more on policy changes and the shakeups at the Department of Health and Human Services now that RFK Jr. has been confirmed and is in charge of the health of Americans. Honestly, I'm loving her content even more than I did before, and so I am so excited that she agreed to be on the podcast, and we have a wonderful conversation with her today. As a dietitian, I care deeply about the health of Americans and the world, honestly, in general. And Jessica and I will talk about what the Make America Healthy Again movement is, which really was spearheaded by RFK Jr. a couple months ago, and how it honestly is completely missing the mark when it comes to what science has shown again and again what will actually improve the health of Americans. Because despite what RFK Jr. says, we actually do have a lot of good science to show what policy changes will actually make us healthier, and he just honestly refuses to acknowledge it. My vision with the Kidney Dietitian is to improve the nutrition care for everyone with kidney stones. The MAHA movement, RFK Jr.'s priorities, and the changes the Trump administration has already made are directly hurting people with kidney stones. Cuts to NIH funding have slowed research to better know how to prevent stones. They've limited access to healthcare, which is obviously not going to help any health condition, including kidney stones. And also their focus on eliminating a litany of food additives that have been proven to be safe is distracting us from policy changes that will actually improve health, including preventing kidney stones. Jessica and I talk a lot in this episode about how it makes a lot more sense to work on getting added sugar and sodium down in our food supply if we do want to go that route of improving health, which will likely improve the health in our health in many different avenues, including reducing kidney stone prevalence in the United States. We also talk a lot about the social determinants of health. We know that people who live in more disadvantaged neighborhoods who tend to have less money are generally less healthy, and they also tend to have more kidney stones. And so there are a ton of things that we can do on a public policy level to help people in these unfortunate situations, which will ultimately improve their health and the health of Americans. I really hope you enjoy this dive into health politics. Even though I know this episode doesn't seem to be directly related to kidney stones, I think it is super important for anyone with kidney stones, or honestly anyone living in the United States, to really understand what is happening in Washington, D.C. right now and what's going on with our health system and priorities at the federal level, because it really will impact all of us, and unfortunately will most impact those of us that are already struggling the most. Because after all, health and healthcare is unfortunately political. And also, I apologize for some of the weird blips in this episode. We have some connection difficulties, but I think you definitely still get the message. So let's dive in. Hello and welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie, and I am thrilled to welcome a very, very special guest to the podcast this week. Her name is Dr. Jessica Knurick. I am going to let her give you a little bit about her background in education because I am not going to do it justice. I am not prepared with an official bio. So, Dr. Knurick, please introduce yourself and welcome to the podcast.
Thank you so much. Happy to be here. Just briefly, I have a PhD in nutrition science. My dissertation work was in the prevention of chronic disease, namely cardiometabolic disease like diabetes. I'm also a registered dietitian. I was a college professor at the University of Nevada for a few years, and then I transitioned into kind of working with medical technology startups. Around the time my son was born, which was about 5 years ago, I started working part-time to be at home with him as well. And so I've been working in that capacity for the last 5 years, consulting for the same kind of area that I was doing before, mostly microbiome research area. But on social media, I got my start on social media a couple of years ago, 2 years ago. really focused on the pregnancy postpartum space because that was what I was kind of experiencing at the time and seeing a lot of information about online and seeing how much misinformation was targeted at that population and demographic online. And so that's what really brought me to social media.
Mm.
But as you know, in the last, half a year, I've really kind of transitioned some of my content to be much more about nutrition policy and still nutrition science, but kind of talking about how the politics of nutrition impact our food environment and our health.
Yeah. Yeah, awesome. It's so funny. We have very different niches, obviously, but sort of similar story. I just started the Kidney Dietitian. Actually, it was my COVID project because what else was I doing, right? And
Yeah.
was just really driven to put good quality science-based education into the world for kidney patients and specifically kidney stones because there's so much misinformation. And it's just honestly kind of heartbreaking how people feel like that nutrition has to be so complicated. But as I imagine we'll talk about later, it really is kind of more common sense than you might think it is. I
Yeah.
feel like.
Yeah, but that
So
doesn't make for good social media content,
no,
right?
no, it's not very clickable. When I'm just like, hey, eat more fruits and vegetables, that's not very
Yeah.
exciting. So, yeah, very cool. Well, thank you again so much for being here. I know that this episode is a bit different than a lot of the other topics that I tend to cover on the podcast, but this is something that I think is very relevant for a lot of our listeners here in February of 2025. And so I just wanted to be able to have a chat with you so my audience could learn a little bit about the potential impact that policy does have on our health as a whole and also on kidney stones. So, we will kind of dive right into it. So, what is MAHA or Make America Healthy Again? Kind of where did this come from? Who did it come from? What is going on with this?
Yeah, so it's a political movement that was started really with it started, I mean it kind of uses the tailwinds essentially of the wellness influencer space that's been thriving for the last decade-ish on social media. But it really started in August of 2024 when RFK Jr. and Donald Trump kind of partnered together. And they came out with the slogan, Make the lines of "Make America Great Again."
Mhm.
And so the whole idea of our food supply is poisoning us, and we need to clean up the food supply and clean up the corruption. And RFK Jr. is the one to do that. And he really partnered with a lot of wellness influencers with very big platforms on social media to spread this message. And so it caught on really, really well. And a lot of people, I mean, who doesn't want to make America healthy again? And who doesn't want
No
to,
one disagrees with that.
have a cleaner food supply and all of those things? And so it was a great, really, really good message that caught a lot of people's attention. And so it was a pretty powerful movement and it helped him get elected.
Hmm. Yeah, the timing is interesting, right? August is
Yeah.
right before the election in November, obviously.
Yeah, which is
Um,
why I call it a political movement.
Yeah, absolutely. Absolutely. So you kind of touched on this, but what are the messages or specific things that MAHA seems to be focusing on most? What is their argument or things that they think should be done to, quote, make America healthy again?
Yeah, I mean, I think I like to start with kind of like where I agree with them, because there are places of agreement as somebody, who's been in this field for so long. And my whole goal, I mean, the whole reason I got into this field was to help people get healthier, right? Like that's
Most
what
of
I
us
cared
did, yeah.
about was to reduce
Yeah.
chronic disease and help people get healthier, and so there's a lot that I agree on. For example, our food environment is broken. So they'll talk about our food environment being broken as if all of the foods are poisoned, and that's really not it. The food environment is broken, and I have videos on this, but it's not a conspiracy why our food environment is broken. It's a direct result of pro-corporation deregulatory policies that have allowed corporations to prioritize profits at the expense of people's health. And so what we have now is a food environment that's really great for corporations and corporate profits. And it's about 70% ultra processed foods. So these packaged foods that are cheap to produce, can sit on the shelf, corporations and you want to eat a lot of them, right? Because they have
They're
either
tasty.
yeah, and they have a lot of sugar, salt, and fat, and or fat, right? And a combination of two out of those three is really the combination of a hyper palatable food that you eat a lot of. And so
Hmm.
right now, the majority of the American diet, because of this, are these ultra processed foods. And so that is an issue. And we removed, starting in the 80s with the farm crisis, but we've started to remove local food systems. And so we don't have local food systems like we used to have, which has resulted in a lot of food deserts in our country, and a lot of consolidation. So big ag really is consolidated, which also fuels kind of the rise of these ultra processed packaged foods that have to travel far to these areas of the country that don't have their own local food systems. And
Yeah.
so when they
I
say our food environment is broken, I agree with that. Just I disagree with what they mean.
Yeah, absolutely. And I'm wondering if you can comment on, because I know that this plays into it a little bit about how, okay, I don't know the exact percentage, but something like 15% of people in the United States are living with food insecurity, and however many percent, astonishing large percent are living in poverty. Um, and obviously, if you can barely pay rent, you're not going to be paying a lot of money for your food. And so that's going to potentially be driving people to purchase these cheaper ultra processed foods, I imagine.
Yeah, I mean, food insecurity is a huge problem in our country, and that's one of my problems with this Make America Healthy Again movement is they don't, they want to look at all of the data that looks at the entire population, right? So they want to look at the chronic disease rates in the entire population, but they don't want to look at who is most affected in the population. And who is most affected is the lowest income among us, right? And so right now we have 14.5% of our country live in food insecure households, including 1 in 5 children. And what that means is that they don't always have access to the food that they need to meet their nutrient needs, not necessarily their calorie needs, because they have these ultra processed foods in these food deserts, right? They can go to the gas station and buy a bunch of these ultra processed foods, for example, but they don't have access to fresh produce, or like fresh kind of protein sources and those types of things.
Mhm.
And so that's what we mean. They're not able, because of cost, are not able to get the food that they need to meet their nutrient needs. And so that's a real issue. And we have some research showing that if you stratify by income groups, and you look at the highest income group versus the lowest income group in the country, there's a 15-year life expectancy age gap for men and a 10-year life expectancy age gap for women. The greatest predictor of health in this country is wealth. And so we what the MAHA movement is doing, and what a lot of wellness influencers do, is they use the data from the entire population to say our health is terrible. Here's all the statistics to show, and then buy my $89 greens powder, or buy my $60 whatever
Olive
supplement, or
oil,
buy my
whatever. Mhm.
$2,000 hyperbaric chamber, whatever it is, like. And so they're really like kind of exploiting the data on the whole country to then cater to the wealthier people, who are honestly the ones who are doing okay health wise. And
Mhm.
so that's a big disconnect with this movement that
Yeah.
I've seen. They don't really discuss food insecurity and helping the lowest
Yeah,
income
because that's
people.
not going to make them any money, obviously.
No, there's
Helping
no
poor
money in
people is not is not very
that.
going to make much money. And I think it's fascinating, because I have gone outside my comfort zone in the social media space. I see myself as sort of a, you know, influencer, obviously, of sorts, as an online space. And I've been trying to just put my 2 cents into some of these conversations. And it's amazing how just because I have dietitian in my handle, it's immediately you're attacked because you are brainwashed, it seems, by Western medicine. And it's almost like, the in addition to trying to make money, they've acknowledged that they need to hit hit like discredit people who have actual science to back them up. Does that make sense?
Yeah, it
Yeah.
absolutely makes sense. And I don't I understand where I understand it, because I'll tell you, before I went to school for nutrition, I mean, what got me interested in nutrition was as I said, I wanted to like help people get healthier. But there's like a gateway, right? And so what I started doing was like reading blogs on the internet. They didn't really have social media back then, but
Yeah.
I started reading like, Dr. Axe, like chiropractor blogs,
Hmm.
right? Mark
Yeah.
Hyman and all of these like wellness influencers, and doctors turned wellness influencers in Mark Hyman's
Hmm.
case. And that really got me interested. And so, and there's something called the Dunning-Kruger effect. The less you know about a topic, the more you think you know. And so I really did think I knew so much about nutrition in those early years when I was just like living my healthiest lifestyle for me, right? And so there was this sense that like the modern medical system was
Doesn't
brainwashed,
know
and
what
they
they're
all
talking about.
was all big
Mhm.
pharma, and I have the secret over here, like with in the wellness space. And then you kind of combine that with this idea that like, okay, well, at least in the the wellness space is the one making money too, right? Like me as a scientist and science communicator, I'm not selling you products. I'm not selling
Mhm.
you supplements and things like that. So like if you want to go into a more lucrative space and you don't have the years and years and years of education, I mean, the wellness space is the place to be. You know what I
There's
mean? Like,
trillions of
it-
dollars. You probably know the numbers, like
yeah,
an
yeah. It's way bigger than
unbelievable
big
amount of money.
pharma, way
Yes,
bigger.
yes, yes.
And so, I mean, this is me being like my least generous interpretation of people, I'd say. I tend to be more optimistic. I'm in a bit of a pessimistic mind space right now, so that's going to come out a little bit. But you know, if you want to make, if you don't have an education in this field and you want to make a lot of money, I mean, the wellness influencer space, what are you going to do? You're going to get people to distrust people who actually do have an education in this space, right? And make sure that they don't know what they're talking about. So then you only trust me and my solutions. And then you get them into some sort of funnel and you sell them supplements and you sell them
Mhm.
wellness solutions and you grow a big following because fear and conspiratorial marketing go super fast on social media. And we see that play out time and time again. And unfortunately, it's really difficult to break through with evidence-based information. We're trying, we're doing okay with some in some spaces, but it's certainly a better business model to be in the wellness
Mhm.
space.
Absolutely. I say all the time, I'm sitting over here saying, eat more fruits and vegetables. That's not very exciting, but that's
No.
really kind of what health comes down to. And obviously, my message and all of many other dietitians is going to get lost in this very clickbaity, your food is poisoning you type narrative.
Yeah.
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 Okay. So we kind of touched on it, but maybe can you dive in a little bit more about the specific priorities that MAHA has in
Yeah.
terms of what they're trying to do to quote, make America healthy again?
Yeah, so I think it's a couple things. And you'll see kind of like a theme here. It's very conspiratorial, very anti-corruption, very scientists are bad in terms of all of the things that they're setting forth. So first of all, they talk about our food supply and they talk about poisonous ingredients. And so they point to poisonous ingredients. There's a lot of like on social media, people comparing, you know, the food dye in our like cereal to the food dye in Canada or Europe and saying that like we get the unsafe version here. And what that misses is obviously that health agencies all around the world have deemed those food dyes safe, right? And then there's different reasons for different regulations. And I try to explain like a big part of that is preference. You know, so if we, I mean, corporations are going to make what consumers demand. If consumers want more, you know, more products with like natural color additives, they're going to make it. And I gave this example the other day. I don't want to get too off topic, but I
The
have
Fruit
fruit
Loops.
there's at
I
my
saw
yeah
it. Yeah.
at my King Supers, which is Kroger here in Denver. You know, there's Fruit Loops, which has the artificial dyes, right? The
Mhm.
red 40, the blue one, and then there's Fruitful O's that has the natural dyes. Now, if I go to the store and thousands of us go to the store and we choose Fruitful O's over Fruit Loops is going to be like, oh my gosh, they're taking market share. Let's change and adapt our formulation so that people start buying our product again, right? But that's not happening. Actually, the exact opposite happens. And we saw it when General Mills in 2015 took out their artificial colorings and put in natural colorings. And they got so much backlash and lost so many sales. And people called them dull and gross looking that 2 years later, they had to come back with artificial dyes and reintroduce them into their cereals. And so it's really a preference thing, not a safety thing. And so they position it as a safety thing when all health agencies all around the world, Health Canada, the EFSA, European Food Safety Authority, the FDA, they've all deemed these additives safe in these food colorings, I should say, safe in the amounts that we consume them. So
Mhm.
that's one. Poisonous food is one of the things. So they need to get rid of the poisonous
Yeah.
food. And the second thing is the corruption in our health agencies is a big one. So science corruption, we're not studying things. And a big thing is like RFK Jr. will be like, well, we need more science, or if you show me the science, then I'll believe you, or whatever. And we have a lot of science in a lot of areas that they say we don't have evidence in. For example, this idea that we need to study the reasons for chronic disease. It's like he just completely disregards
That we know exactly why
the
chronic
wealth
disease.
so as someone who has a PhD in chronic disease prevention. We have the research to show
Yeah.
what are the main contributors of chronic disease and the increase in chronic disease in our
Yeah.
country.
Which is just
Um,
distracting us from being able to actually do something about it, which is exactly what he wants. So he and other
yeah.
wellness people can continue to sell you things if I had to be super negative and pessimistic about it, right?
Yeah, I mean that's the
Yeah.
inconvenient truth, right? We have the research, and the research suggests that it's many, and we can talk about what those are, but many things that come from policies that the party he is now aligned with has consistently voted against for the last multiple decades, right? And so you can't speak to those policies, you can't speak to income inequality, you can't speak to food security, you can't speak to these government programs that are really important. But so instead you're going to cast doubt at our health agencies and our scientists and calling our food poison, and saying that that's the reason for chronic disease in our country. And it's the reason he hasn't worked with any nutrition and food scientists, any public health experts, and really has focused on working with these wellness influencers on this. And you saw it even on the Senate floor when he was having his confirmation hearings. He used wellness influencer pseudoscientific jargon when he was talking about the food additives. He compared, 10,000 food ingredients in our food supply to 400 in the EU. And I did a video explaining why that's completely a lie and completely misleading. But people don't know, so they don't know to like fact check him.
Yeah. It's been fascinating as, you've watched all of this, unfold over the last decade, really. And as a scientist myself, it is like insane to me how when you go and present something at a scientific conference or if you publish a paper, you have to cite every single thing that you say with quality evidence, right? So I just have lived in this world, right, as I've gone through my career in this world where you have to prove what you're saying. And it is astonishing to me that at a public health level, like our government just doesn't have that same regulation as what we scientists have to do. You had a great video the other day, I believe, about what a peer-reviewed paper is and kind of the process that is. You have to go through and make sure that every single thing that you're saying in there is actually true and it's proven. And that just seems to not be the case when you're talking about government things.
Yeah. I ended up talking about peer review process because there's a journal out there that looks very similar to a quality journal. Like even
Mhm.
some PhDs
It
that
looks
follow
good.
me, they're like,
Hmm.
I didn't even realize it
Yeah.
wasn't. And
Hmm.
it's a WordPress blog, but it says like peer reviewed journal, and
The
they're like
format is just like a
publishing.
real journal article, like the two columns.
Yeah, and they're
Yeah.
publishing a bunch of
Hmm.
like anti-vaccine or anti-establishment science, and it's science. I put that loosely in quotes. And yeah, you wouldn't even know.
Yeah.
Very dangerous.
Yeah. Okay, so it sounds like taking out these random additives that random people on Instagram have deemed unsafe is not really going to improve the health of America. So, again, you kind of touched on it, but can you really dive into the exact things that you might recommend that our government do to actually make America healthy again?
Yeah, well, let me just say one more thing on this like
Sure.
food coloring thing.
Yeah, sure.
So this is like a place where I kind of agree with Make America Healthy Again, right? Like so I do videos where I like because it just frustrates the hell out of me when like people are just making things up, right? They're saying, well, we use these food dyes because we are trying to poison you, whereas other countries use the safer food dyes. There's no evidence that those food dyes are safer, and those health agencies have deemed them safe for use. Like you can go to their health agencies and you can see that they're deemed safe for use. And so it's not for, again, not for safety, it's for generally personal preference. But where I agree is that food dyes aren't necessary, right? They're not like an emulsifier or even like a preservative, like
Hmm.
that's necessary for these packaged
Hmm.
foods, right? They're really a marketing tool. I mean, and
To
food
make it look
dyes,
good.
these
Hmm.
artificial food dyes are used a lot in kids' foods, right? To make them want to eat more and make it's a marketing thing for kids.
Hmm.
And so I don't like I'm not pro artificial food dye, and I think that kind of gets lost sometimes when I talk about this. I'm pro being honest about the conversations we have and what that scientific evidence actually shows. And then if we want to take a more precautionary approach to some of these food additives, do that. But I'm not pro the FDA is corrupt and they're allowing poison into our foods, because that's just literally not it. Like
Hmm.
we have good safety data for most of these additives, and that's why they're allowed in our food. And as does the rest of the U or rest of the world allows
Yeah.
these in our food. So that's just an example of like where there's agreement in some places. It's just the approach is like so disingenuous and so like conspiratorial that's where where I differ.
Yeah. Yeah. Can you, in a few sentences or maybe paragraph, explain what a food additive would have to, like the process that would have to go through to be deemed as safe by the FDA in the United States? Just kind of like so people have some concept. It's not like people are like food companies are just adding these chemicals to our food randomly. Like all of those ingredients have to go through some sort of safety process. So can you give us like a very high level understanding of what that is?
Yeah, just like at a really high level, food additives, that's a specific definition. And so, like for example, food dyes, you can't just add those to food if they've never been tested. So they have to be tested for safety, and then they have a like what is it called? Like a safety index that they use. So they basically test them in animal models, and they look to see if there's any adverse effects. And then they take a level where there's no observable effect. So it's called like a NOEL. They haven't seen any negatives with these additives. And then
Mhm.
they put a safety factor of like
A
hundreds or
ton.
1,000 right on top of that. And so you can't have more than that in the food in a food. And so it's a very like precautionary amount that is allowed in the food based on the available data. And so that's what's done. And so once they have that established, an ADI, then they allow it in our food supply.
Hmm.
And then they continuously, well, not continuously, but intermittently monitor it. And so do other countries in the world, right? And so let's say, for example, if the EFSA does a monitoring, but the FDA hasn't done it, and they find something that might spark the FDA to be like, oh, well, okay, they found because they work. I mean, these people communicate, and so it might spark something for like maybe the FDA to take a look with. Do you want me to explain red dye
I was just
3?
gonna, yes, go
Yeah.
ahead. Just gonna
So this
ask.
just happened with red dye 3. So
Mhm.
red dye 3 has been in our food supply for a long time. Now it's not used nearly as much as red dye 40. I think a lot of people were confusing the two. It's used really because like in like fruit cocktail and stuff, it was the only one that would actually like give a red flavor.
Maraschino cherries. That's like the
Yeah, like
classic
maraschino
example too, right?
cherries.
Yeah.
Yeah. And so anyway, it's been in our food supply, and it was banned in cosmetics back in the 80s, I believe. Don't quote me on that, but I think it was the 80s. And but it was allowed in our food supply. And so there's something called the Delaney Clause. And the Delaney Clause is this really old clause that states that any chemical that has been found to cause cancer, and that's a key word, cause cancer at any dose in any model. So when I say model, I mean animal model, human model,
Cell
anything,
model.
um,
Hmm.
cannot be in our food supply. And so when the studies came out, and these studies came out in the 80s, it was one or two studies, it showed that red dye 3 in really high amounts, it was 4% of the rat's body intake was of red dye 3,
Yeah.
induced tumors in male rats only. Now, it induced tumors through a mechanism that they don't believe exists in humans. And again, it was 4% of their body weight. So it was way, way, way more than what we would
Yeah.
be exposed to, especially red dye 3,
I'm
which
trying to
like
like calculate. That would be like cups and cups of straight red dye number three for a
I
human.
mean,
Like,
yes,
yeah,
like 4% of your body weight. That's a
it-
that's a
that's a
lot.
lot.
Yeah. And so anyway, but because of the Delaney clause, the consumer science, like for public health, they're like a group of scientists. They petitioned the FDA in 2022 to remove red dye 3 because of the Delaney clause, not because it's been shown to cause harm in humans,
Mhm.
not because it's been even shown to cause harm in animals at a physiological dose that we would be exposed to, but because it was shown to cause harm in these male rats through a mechanism that doesn't exist in humans.
Mhm.
Now, all of that context is very, very important, but that gets really lost in this wellness social media world, and with MAHA, to say that like red dye 3 is poisonous, and
Mhm.
finally the FDA is taking it out of our food supply. It's just a fundamental misunderstanding of kind of, the dose makes the poison sort of
Yes.
deal, and
Yeah.
also how our regulatory systems work.
hmm And the red dye number three, I think, is really a great example of those systems working, right? Like there
Yeah.
was like the tiniest piece that maybe this could cause cancer in rats, and we're like, okay, it's out, right? Like this is just an example of how our food supply is regulated, to help keep us safe. So to kind of recap, basically, it sounds like everything that they add to our food has to be tested, and it is tested in animals. And if there's any harm, we then allow it in our food at like hundreds to thousands of levels less of what it caused harm in rats.
Yeah, that's correct.
We lost Jessica for just a little bit during this episode. Right here, we had some connectivity issues, but she was just giving us a little bit of background about how there was actually industry influence in the decision to include red dye number three in our food. So let's get back to the interview.
So it didn't retroactively apply, and so that was their standing, and that surely was partly due to industry influence, especially like maraschino cherries, right? That
hmm
industry being like, no, we need red dye 3, right? Now that is an example of industry influence allowing that to stay in our food. But if red dye 3 was if there was any evidence of harm, it doesn't matter the industry influence. It's not staying in our food, right?
hmm
So it is an example of industry influence allowing that to stay in our food, but it again, it wouldn't have happened had there been like evidence that at the levels we were exposed to through a mechanism that was important to us, right? Right, that actually
hmm
was applicable to
Relevant.
us,
Yeah.
yeah, relevant, that it would have stayed in our food. So
Yeah. And I think it's
that's an
also
important
important
distinction.
to put this into context of like maraschino cherries and Fruit Loops were never meant to be health foods, right? Like there's no one's eating maraschino cherries and Fruit Loops and thinking this is something that's really, really healthy for me. And kind of going back to I think what you were kind of saying before, like the like we know that ultra processed foods are not the best for us. I always struggle with that because I think there's definitely a place for some processed foods in our diet. But in general, most of our diet should not be ultra processed foods. These foods are not good for us, but it's not the red dye number three that's really causing harm in these ultra processed foods. It's really the added sugar and salt and fat that you mentioned earlier.
Yeah,
Yeah.
absolutely. So that's why we say like, if we swap red dye 40 out and add like beetroot juice into Fruit Loops, it's still Fruit Loops, right?
Right.
If
It's
you
still
do it with
sugar.
Skittles, it's
hmm
still Skittles. It's still a high sugar, no low nutrient food that we probably should be consuming less of.
Yeah.
Um, and just quickly, maybe we should define what ultra processed food
Mm,
means.
good.
It's a it's from nutrition science research, and we use it to stratify. So there's unprocessed, minimally processed, processed, and ultra processed. And I think a lot of us we have this idea that processed means bad, and it's not the case,
hmm
right? We need processing. It makes food more accessible. And it's
Safe.
even cooking is processing. Yeah,
hmm
safe.
Yeah.
And so ultra processed is this category that it basically means that it's a food that has an ingredient or a processing method that you wouldn't be able to replicate in your own kitchen. And so it relies on these things that manufacturers have access to, but we don't. And so, as you said, even within the category of ultra processed, there are better, more nutrient dense choices.
Mhm.
And then there are choices like Skittles, right, where there's
Yeah.
not really a lot of redeeming value in them,
Other than being
except for they
delicious.
bring you joy. I don't know.
Yes, yes,
Yeah,
exactly.
which food is not only for fuel, right? It's not only to like nourish your body. It's also, socialization, and it's nostalgia, and it's joy, and like all those other things, which is an important conversation. But
Yeah.
that's essentially what ultra process is. And the best example is with corn. Corn picked from the garden is unprocessed.
Mhm.
Frozen corn kernels are minimally processed. Canned corn that has a little salt added is processed. Again, not bad, just
Mhm.
processed.
Mhm.
And then Dorito chips would be ultra processed, right? So that's really the best way to explain it.
Yeah. Yeah. And I feel like this. this narrative of this ultra processed foods being so bad for us and processed foods, I think I've gotten a lot of questions like, is it okay to eat frozen vegetables? Is it okay to eat? I recommend like sparkling water, right? Because for kidney stones, we talk about drinking a lot of water, and these things are totally fine and very health promoting foods. So I feel like that is a really important distinction, that just because something is processed doesn't necessarily mean that it's bad. There's such a wide variety of things going on there.
Yeah, yeah,
Yeah.
absolutely. I agree.
Yeah.
Important distinction.
Okay, so going back to what can we actually do to make America healthy again? So if you could like
Yeah, yeah,
wave your magic
yeah. Okay.
wand, what would be your top priorities in terms of policy to actually improve the health of Americans?
Yeah, so I have a whole Substack article about this where I literally lay out an entire plan moving forward in
Nice.
America if we actually want to, lower chronic disease and help the country's public health. But yeah, let's look at it from two different places. First, let's tackle our food supply. So improving our food supply and then public health in general. So
Mhm.
when we talk about our food supply, I already mentioned the vast majority of it is ultra processed foods, and it really favors these corporations and not public health. And so some of the strategies to start addressing that is to look at our subsidies. So right now, the vast majority of our subsidies in this country, and subsidies are basically payments that decrease the cost of crops. And so right now, we subsidize corn, wheat, and soy primarily in our country.
Mhm.
Corn, wheat, and soy by themselves are fine. They're good, they're important grains. But here's the thing, the majority of that doesn't even go to food for people. It goes to animal agriculture, so food for cattle, and fuel. So like, for
Mhm.
example, corn, 40% of our corn that we produce goes to animal feed, and 40% of our corn around there goes to fuel. And so we have this kind of like agricultural system that is not even really set up to feed our people. And then we don't subsidize fruits and vegetables. So less than 1% of subsidies go towards fruits and vegetables. Now, you have to contrast that with what the government tells us to do. So my plate, which you and I are both familiar with, half of my plate, it says make half of your plate fruits and vegetables. Okay, so we're telling people to make half their plate fruits and vegetables, and then if you look at our subsidies, less than 1% are going to fruits and vegetables. So what does that do? That increases the cost of fruits and vegetables relative to ultra processed food, because ultra processed foods are predominantly used like comprised of corn, wheat, and soy, right? So
Mhm.
that's kind of so the corn, wheat, and soy that is produced, a lot of that goes into these ultra processed foods, and so we kind of artificially decrease the cost of these ultra processed foods. Like if you go to some other countries, their fruits and vegetables are a lower cost relative to these ultra processed snack foods, right?
Mhm.
Those are actually higher in cost. And
Would
so when you do that, yeah, go ahead.
I was just going to say, just because I'm interested, what would you say to the argument of it essentially comes down to a supply demand? Like if Americans were demanding that we eat more fruits and vegetables, which generally we're not for a wide variety of reasons, would we then start subsidizing fruits and vegetables?
No, subsidies don't really have anything to do with demand.
Okay, so no.
Subsidies are yeah, those are, and again, remember, we don't, I mean, most of our subsidies don't go toward food for humans,
Right. It's
right?
yeah.
It's
Yeah.
going towards food for and the food for animal agriculture also decreases the cost of kind of low cost meats as
Hmm.
well.
Yeah.
And so and this is like a whole other conversation we can have about these
We could talk
agricultural
for
subsidies.
hours,
The
I'm sure.
initial intent was good. It was to help farmers. But now we've seen kind of like what's happened because of it and our food supply because of it. And so readjusting those subsidies, helping investing in farmers to help them bring more local food systems in. So into some of these food deserts, incentivizing grocery stores to go to these food deserts
Yeah.
or some sort of reimbursement system. But bringing local food systems back is really important to help with the food supply as well.
Hmm.
And so that's kind of addressing food supply. Now, also in that is regulating corporations. So we, as I mentioned kind of at the start of this, operate very much in a pro-corporation deregulatory environment, right? A lot of our policies are that way, particularly with one political party, but both political parties are not great. And so we allow corporations to lobby. So they lobby for things like lax antitrust laws so that they can basically consolidate the food environment so that we have very few corporations that basically own the entire food supply. Now, there's a number of issues with that. We allow these corporations to lobby for lax marketing rules so they can do basically unlimited marketing to children and low-income populations. And so all of these lobbying efforts, we allow them to lobby to for these subsidies to keep their foods cheap, right? Because their number one goal is profits and growth. They don't really care about our health. And so now we have a food environment that again is the result of decades of that. And so kind of putting regulations on these corporations from their aggressive lobbying, and all of the other things that they lobby for. That can be really important. So that's really, those things would really help our food environment. Also looking at things like, decreasing sodium intake in some of these foods, streamlining some of the foods. That could be helpful too. There's a lot of policy changes that could happen that are evidence-based policy changes to improve the food supply. And then you look at a public health level. And again, public health policies have to target our lowest income Americans because that is who is struggling the most with chronic diseases by and far. And so you look at expanding food and nutrition programs. So SNAP is the Supplemental Nutrition Assistance Program, expanding things like WIC and expanding nutrition education within SNAP. So SNAP has something called SNAP Ed, which is education on like the importance of vegetables and fruits and getting all of your nutrients. And they also have, a lot of states have something called Double Up Bucks, where you get like double incentives if you spend your dollars on fruits and vegetables. And so those incentive programs can go a long way with helping them to get more nutrient-dense foods. And then investing in public health systems, investing in the social determinants of health, which are these social policies that can directly improve public health, things like improving economic stability, improving education access, improving what we call the built environment, which is making our towns and cities more walkable and bikeable. MAHA likes to compare us to Europe all the time and our ingredients to Europe, but they don't compare our social policies to Europe. They don't compare the fact that in Europe they have universal health care, so everyone has access to health care. People aren't turning away an ambulance because they can't afford the bill of the ambulance, right? They're going to the hospital. They're going to preventive care checks. They have paid parental leave so that they are able, so they don't have to go back to work after. So they invest in their people. They invest in social programs that help people to then thrive, and they see better health outcomes because of it.
Mm-hmm. I
But
can't even follow that up. Ditto.
I mean, but do you
Yes.
hear how like hard that is to explain and how like involved it is and how like people could probably glaze over and be like, well, that's just a lot.
Mm-hmm.
And how does that have anything to do with nutrition? We are just worried about the poisonous foods. It's like MAHA talks in ways that people can grasp and they can understand, and it's an easy message, and it's a conspiratorial, fear-based message that spreads really fast on social media. And unfortunately, that's what we are up against.
Mm-hmm.
But we're not going to see positive health outcomes from it, unfortunately.
Yeah. That's a really great segue into my last question for you. So, it is early February, and the Trump administration has been in place for, oh gosh, 3 weeks now or
2 weeks,
so. Only 3 weeks.
Going
And there's been quite a few executive orders and huge actions taken by the Trump administration. I'll ask it both ways. So, are there any that are especially concerning to you from a public health standpoint, and also any that you think might make things better?
Yeah, so I wrote an entire article about this yesterday. It took me hours and hours and hours, about
It's a good
twice
one.
to
I
three
read it
times as
this
long as
morning.
I thought it was going to take me. Because, and I think that's the point. I think all of his executive orders and directives that overlap and are hard to follow and hard to figure out, and I think it's all by design. I think it's meant to be chaotic and meant to be overwhelming and exhausting, essentially. And so. He's done a number of things that are very concerning for public health and science in general. So, I mean, his first day, he withdrew us from the World Health Organization. He on a president's first day, often, I mean, this isn't super uncommon. They basically rescind executive orders from the previous president,
Mm-hmm.
right? And so, because that's the thing about executive orders is they can do something quickly, but it's not like it's a
Easily
law.
undone.
Like if it goes through the legislative process, it's very easily undone. And so he went back on a number of Biden era policies. So, for example, it rolled back some Affordable Care Act, which is our healthcare system policies. He rolled back some like water to protect the water to get PFAS out of the water, which are these substances, these forever chemicals, quote unquote, they're called. And the goal was to basically like put limits on the amount of PFAS that can be in our water. So he rolled that back so that really that's a pro-corporation move because that really benefits the corporations. He reversed a ban on menthol cigarettes, which is like
I missed
wild
that
to
one.
me.
I
It's
yeah.
which is crazy because I mean it's estimated to save 650,000 lives and I mean it directly targets lower income people and menthol cigarettes are known to be more addictive than other cigarettes and so there was a ban that was going to go into effect and he stopped that ban and I believe cited concerns about like personal freedom and government overreach, which is really I mean usually the case for Republicans. They are usually like that, except I guess except for with the MAHA movement, where they're pro-government overreach and lack of personal freedom with like getting ingredients out of food supply. It's very confusing to follow what they want to do. So, I mean, those are some of the executive orders that he originally did. And then the stuff with science is quite concerning. So he put communication freezes on all of the health agencies, which again, that's fairly standard to do, except for the scope of the communication freezes was unprecedented. And so basically these health agencies, it's really important to get like reports out because researchers use those reports and medical people use medical doctors use those reports. And so he halted all of that. He put a halt on all NIH research and grants, which is very concerning because he basically wants all research to align with his
Agenda.
administration's priorities and agenda, which essentially means that he has like specific things that he doesn't want researched, and that's not how research works under a democratic country. And he initially paused all federal grants, which included, federal aid grants, which are these like programs that help low-income populations. Now that one was stopped by a federal judge. That's the other thing about executive orders. I think a lot of people get overwhelmed by these executive orders, but they usually have to go through this. They usually will be like there'll be like a legal process. And so a judge put a temporary stay on that and Trump rescinded that. So money was able to go out. But a lot of those agencies like even Healthy Start, which is targeting low income individuals and education, there was a lapse in their funding. And so that was really problematic for them. He's also removed a lot of science websites from like the CDC, including reproductiverights.gov and a lot of other ones that don't align with what his administration thinks should be being done in healthcare and science, which is concerning. And there's so many other ones. Oh, and the one that just happened, he issued basically a page of words that are not allowed to be used in scientific research,
Like
coming out of
LGBTQ and those
and
types
gender.
of things, gender
Yeah.
affirming, yeah.
Yeah,
Yeah.
transgender, but
So
also
it's
gender.
censoring of gender. Yeah.
Yeah, so basically,
So
I mean,
like,
censoring
yeah,
words that can be used in scientific publications,
which is
which
fascinating because if you may or may not know, like a very basic tenet of research is describing the population that you're researching. And very often you'll describe perhaps race, perhaps gender, or sex, however you want to define that, I guess. And that is critical to understand that data because people are different, right? Men and women are different. People experience life differently. And so that is key to understanding research. And if you can't say that, that's just like, it's just odd. It's just very concerning.
Yeah, I mean, I think obviously the goal is because now the stated administration's priorities or state like beliefs are that there's two genders, right? There's two
Right.
genders.
Yeah.
And so that's now like the law of the land is that there's two
I
genders.
suppose.
And so I guess what they're trying to say is you can't use the word gender in
Yeah, you have to use
research. You have to
sex.
use the word sex.
But still,
And again, but that's very, this is not my field of research, but researchers in this area will tell you that that's very problematic. And so
Mhm.
it's kind of, it's politicizing scientific research, which is, there have been instances where that's been done before in other countries and regimes, and we should look into what those are. It
Yeah.
never ends well.
Yeah. I just got back yesterday from a scientific conference about kidney stones, and many of those people are academic doctors, and many of them are just researchers in kidney stone, sort of basic science. Many of which are funded by the NIH, right? Their entire job is NIH funding, and so it was such a weird juxtaposition to be with that group of people, which is so exciting always. Like I love the conference and like get to see tons of people and everyone's so excited about kidney stones, which doesn't happen very often, right, in many groups.
Yeah.
But also this kind of like giant cloud of like, well, I don't know if any of this exciting stuff that we're talking about that we've been doing is going to be able to go on, right? So like this is having a direct impact on your health, right? As a person listening to this podcast who likely has kidney stones, and obviously much more than kidney stones. This is impacting every area of research and health, period.
Yeah, and I think an unintended or maybe intended consequence of this is it's just I have lots of scientists and medical professionals who follow me, and I have conversations with them every day, and a lot of them are just scared, right?
Yeah.
They're scared about their job, they're scared about their funding because a lot of them are funded through the NIH, and like this administration can just like shut down their funding if they want to, and basically like ruin their livelihood. And I think it will have really wide-reaching, long consequences on science in general, and people and young people getting into science.
Yeah.
Unfortunately.
Yeah. Okay. Well, any last words?
A bit of a tangent from MAHA, but
well, yeah, that's okay. But it's all relevant. So any last words before we end? How would you like to end this episode? Any positive last words?
Well, RFK Jr. just the morning we're recording this, RFK Jr. just got through his Senate Finance Committee hearing, and so he will his vote will go to the floor on the Senate, and I'm sure he'll get confirmed. So moving forward, I think that we will need to just hope for the best, that he really wants to make America healthy again, and that I'm just being the cynical person who is seeing things through a cynical lens. And because I think at the end of the day, we all want Americans healthier. And so hopefully, they aren't in it for the wrong reasons, as I've kind of highlighted and think. We'll move to kind of improve our food supply and improve public health, because one thing that MAHA gets right is we do have a chronic health crisis in this country, and we do have a poor food supply. And so if any movement can be done on that, that would be great. I just hope that we can elicit the help of actual experts in their fields and scientists and public health experts who have dedicated their lives to this area to help make that happen. But either way, we're talking right now in a public health lens. From an individual health perspective, which you and I probably talk a lot about too, the basics of health are pretty basic and pretty boring, right? So eat food, not too much, mostly plants, like Michael Pollan says, and that's really it at the end of the day. And try to move your body as much as possible. Try to reduce stress. Try to sleep, and that's all we really can do.
Yeah, absolutely. Well, thank you so much for your time, Jessica. I enjoyed this immensely, and I hope that our listeners do as well. If people want to learn more about you and continue to learn from you, where can they find you and how can they support your work?
Yep, I'm on Instagram. That's my main platform, I would say. And then I'm also on Substack, and I write a twice weekly newsletter there, all about food politics and nutrition.
That's brand new, right? You just started that?
Yeah, I started it maybe a month ago.
Nice.
So
I subscribed.
Maybe 2. Oh, thank you.
Yes. Yeah.
Yeah. So those are the best places at Dr. Jessica Knurick. So just my name, and I would love to see you there.
Awesome. I will link to all of those things in the show notes so people can easily find you. And thank you so much again. And maybe I'll have you on again in 5 years, and we'll have a whole new outlook on public health. We'll see.
Yeah, maybe so.
Yes. Awesome. Well, have a good day. Thank you so much.
All right. Thanks so much.
Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.